In this episode of Ask Dr. Zach,
So I had breast cancer when I was 37. I was diagnosed August 1st, 2007, and I just had a baby. He was almost 16 months old.
And later,
so I fell on my wrist, and turns out it didn't just fracture, it wasn't a clean break, but it was shattered.
Then, on the doctor's orders,
consider the obvious. A lot of people go to their doctor complaining of fatigue, but most of the time it's from bad sleep or lack of exercise or just generally being unhappy.
Paramedics with a stretcher, text 911, emergency, code blue.
In the ER, I deal with trauma and life-threatening situations every day.
With all the hospital paraphernalia and life-saving activity,
I've seen it all.
Dr. Zach stands amidst it all.
I know firsthand that accurate medical advice can save lives. I'm Dr. Zach, and I'm passionate about empowering people to take control of their own health. This is your chance to ask me health questions. No question too big, no question too small. Today we're going to be discussing a topic that each of us or a loved one has dealt with at some point in our lives, and that's cancer. While we're making progress in the fight against cancer, the number of those still being diagnosed with it is still far too high, and millions of people die too young every year as a result. To learn more, let's take a look at the Blazen medical animation.
The human body is
Dr. Zach
composed
looks
of
at the
millions of
monitor
cells
beside
that
him
vary in
displaying
size,
Blazen medical
shape, and
animation of the
function.
human body. It
Cells
focuses
are the
on
building
bones.
blocks of all the different tissues within the body. In healthy tissues, new cells are created during cell division, a process called mitosis. When cells become old, they self-destruct and die, a process called apoptosis. A delicate balance must exist between the rate at which new cells are created and the rate at which old cells die. Cancer develops when the balance is disrupted and cells grow out of control. This disruption can result from uncontrolled cell growth or loss of a cell's ability to self-destruct, resulting in a mass of cells or a tumor.
And we'll be right back with a lot more about cancer.
up next,
A brunette sits before a piano.
So I had breast cancer when I was 37. I ended up having 2 lumpectomies and a double mastectomy with pedicle tram reconstruction.
Red and blue
all
text
this and
as
more
Dr.
right after
Zach.
this short break.
A wet hospital corridor, the ground with a heart monitor and red on the walls. Text reads, Ask Dr. Zach.
So I had breast
Exterior
cancer
of a
when I was
suburban home.
37. I
Inside
was
Sarah Phillips,
diagnosed
age
August
45,
1st,
sits before a
2007.
piano. Text,
And I
breast
just had a
cancer,
baby. He
malignant
was almost
tumor.
16 months old.
In a
I
photo,
didn't
she
know anyone that
squats
had
beside a
cancer
toddler in a
before. It
stroller.
doesn't run in my
In
family.
another, in a
Really didn't
salon,
have
she
any
has her hair
knowledge of it.
shaved
So
off.
when I was
Photos
diagnosed, I
continue
really
Sarah
thought I was going to
child
die.
and had a
I
walk
ended
for
up
cancer
having
with her hair
2
grown out.
lumpectomies and a double mastectomy with pedicle tram reconstruction. Went through chemo, went on tamoxifen, had a hysterectomy, and then switched over to letrozole. At my annual oncologist appointment, my doctor told me that I can stop taking the medication that I've been on for the last 7 years. I think like any cancer patient, you have your pre-cancer days, your life before cancer, and then your life after cancer. And it really is surreal when you're not expecting it, and who really is. I've met a lot of great friends. One of my good friends I met in chemo. I've met other people through the journey. That's the silver lining in the cloud, is the people that you meet.
Hey, so how many more
Clip, a healthy Sarah in the kitchen
Dr.
with her
Zach,
son
can you
making
tell
lemonade.
me, with letrozole for breast cancer patients, is 5 years the standard care, or do you know anything else in terms of different protocols for letrozole? And if I am ending my letrozole this year, how can I best prepare and continue living in a positive, healthy way that will prevent my breast cancer from coming back?
Now it's time to
Red
ask
and blue
Dr.
text
Zach.
as Dr. Zach.
Welcome, Sarah.
Hi,
At his
thanks for
desk in
having
the
me.
studio,
Well,
Dr.
thank you.
Zach
Thanks for sharing
Levine
your
is joined by
story.
Sarah
So you've
Phillips.
been through a lot over the past few years.
Yeah, I feel great now, but I mean, I certainly
Good.
didn't 8 years ago. And I think for me, that's why women are getting diagnosed earlier and earlier. I was 37, and so the treatment protocol that I'm on is just ending. I'm
Yes.
feeling a little nervous, and I'm just wondering if there's anything new that you can share with me that would help extend my life, because I still have a lot of living that I want to do.
Absolutely. So do you mind if I go back for just a second? I just wanted to ask you, how did you discover that you had the cancer in the first place?
It was random, but it was instinctual that my hand went to a spot and it was small and I just felt something and I thought, that's really weird. And it's a long story, it's a crazy story, it's probably like a lot of other women, but I got bounced around, you're too young, it's just fibroids. I checked with my family. All my aunts said, yes, we've got lumpy boobs, it runs in the family. Cancer didn't run in the family, so it wasn't on my radar, it wasn't on anyone's radar. And then I got pregnant and they said, oh, you know, it's probably just pregnancy hormones. And then no one would do a mammogram for me. So it showed up on an ultrasound, but nobody followed up on it. And then I was nursing and they said, oh, we don't do mammograms when you're nursing, come back when you're done nursing. So it was quite like 16 months later that I finally thought, okay, this is not right. And then, yeah, my doctor called me at work and told me you have cancer. And that was the start.
Yeah.
So.
Well, it's quite a poignant story, and it brings up the reason why oftentimes doctors don't recommend mammograms earlier or breast self-examinations is because we're worried about finding things that are benign and then doing all these tests that are unnecessary and potentially harm from that. Yeah. However, you knew something was wrong, and sometimes you're right, and it just takes a whole bunch of pushing. And unfortunately, and as we always say, you want to catch cancer as early as possible because then you have the greatest chance of curing it. Subsequent to that, you had a whole bunch of treatments. So you said you had surgery, you had...
Yeah, I ended up going to London for my surgeries. Yeah. My cancer was one tumor, which was 1 centimeter when I was diagnosed. Okay. And then when they did the mastectomy in January, 4 months later, they found 4 new tumors, and one of them was a centimeter in size. Yeah. So the surgical oncologist was saying, we got everything, you don't have to do any more treatments. Medical oncologist is saying that's a lot of activity for a 4-month period. It wasn't there before. Right. Maybe you should do chemo, or they were recommending chemo. So I'm a big believer in choice, and you do what makes you feel comfortable. So I knew I couldn't do nothing. I'd feel bad for myself if something happened. But I also knew that chemotherapy isn't something you just want to take. So I said, let's cut it down the middle. Let's do half of the recommended treatments that the doctor was recommending. Okay. So I did 1 set of chemo drug and didn't do the second one. Okay. So hopefully that's okay. And then when I had the hysterectomy, I had to switch over to the letrozole, which is that estrogen blocker.
Prior to that, were you on tamoxifen?
I was on tamoxifen for 2 years. Yeah. So I've had a total of 7 years of some kind of medication. And so I guess that's what I'm wondering is, I'm stopping it, but is that what's keeping me alive? Like, right. Should I be taking it longer? I know 5 years is like what they say the standard protocol is.
Yeah, exactly.
Can you take it longer and live longer, or is that it?
There's no evidence the evidence that we have right now is that 5 years is good and is useful. We don't really have evidence at this time that taking it longer is going to be helpful. And it is worth noting that it's not totally benign like any medication.
Oh, I know there's side effects,
exactly.
I can tell you.
I know the side effects, yeah. And it also increases risks of certain things, right?
Yeah.
Like a heart attack and stroke even. So,
yeah.
You're not at high risk of those to begin with, so even though you're increased risk, it doesn't mean you're going to have those. But it's not a totally benign medication. So I think, certainly your oncologist is, you've spoken to your oncologist about it?
Yeah, she knows I'm here.
And yeah, good.
She knows I like to ask questions, so
yeah.
I didn't want to offend her because, she's your team, like that's your team, that's who's taking care of you. For me, just getting as much information as I can, and if 5 years is the gold standard still, what can I do beyond that? What can I do to just kind of keep healthy, keep going?
Yeah, it's basically a lifestyle thing. So I'm talking about regular exercise and keeping your weight down, diet, so especially avoiding fats, like saturated fats, like trying to limit the amount of meat. I mean, it's advice for anyone,
yeah.
But it's especially important, for a breast cancer survivor. And aside from that, it probably seems obvious, but not smoking.
I was never a smoker, so
absolutely.
That's good.
And the other thing is regular follow-up. Just because, number one, it just encourages you and it makes sure that it hasn't come back. And also regular follow-up, speaking with this doctor, you can always keep in touch with her. Even if she says, well, I don't need to see you in person, maybe she's willing to speak to you by phone or email, that sort of thing. And you can always say, is there anything new on the horizon? Is there anything I should be checking for? Is there any new evidence of something that I need to do to improve my odds?
Alcohol. People say that there's a lot of links between alcohol and breast cancer, and we live in Niagara. Everybody drinks wine in Niagara. Do I have to give up alcohol, in particular wine? I don't drink a lot, but I'm just wondering
That's it. You know
if that's one of those things.
Yeah, it's a great question. And alcohol certainly has been associated with a lot of bad things. You probably know there is some association between alcohol and good things too, right? Like red wine.
Yeah, I know. I'm protecting my heart, I think. So, yeah.
So, you know, the answer is really moderation. There's certainly evidence that excessive alcohol.
Yeah.
So like, you know, there are definitions
Not
of these
a bottle
things.
a night,
yeah,
I know,
exactly.
right?
But even, I mean, you even don't want to drink more than a drink a day on average.
Yeah.
You know, but, you know, a drink a day or even less, and occasionally a couple of drinks is probably fine. But yeah, if you overdo it, it does increase your risk for a number of cancers in addition to other disease. So you have to be careful about it. But, you know, like most things, everything in moderation has some benefit.
Okay.
Now, Dr. Zach's prognosis.
The prognosis. Dr. Zach
Sarah had breast cancer at a young age, and unfortunately her doctors didn't pay attention very early, and so the cancer progressed somewhat. It brings up an important point about being an advocate for yourself and or bringing someone with you to push if symptoms don't go away. Now, she's done all the right things. She's had surgery, she had chemo, she stayed on the medication as long as she needed to, and there's no evidence that she needs to stay on it any longer. In fact, there are some negative side effects to it. She needs to maintain her healthy lifestyle of diet and exercise and follow up regularly with her oncologist.
Now, let's ask Dr. Zach about a medical condition in which the bones become brittle and fragile from loss of tissue, typically as a result of hormonal changes or deficiency of calcium or vitamin D.
Osteoporosis, a disease characterized by thinning of the bones. This leads to increased risk of fractures, particularly of the wrist, hip, spine, and shoulders. These can lead to significant morbidity and the loss of quality of life. To learn more, let's take a look at this Blazen medical animation.
Dr. Zach looks at
Osteoporosis occurs when the body fails to form enough new bone, or when too much old bone is reabsorbed by the body, or both. In normal, healthy bone, remodeling occurs when osteoclasts eat away at the bone tissue and osteoblasts come in and refill the holes with new bone. As part of this process, the body uses calcium and phosphate to produce strong bones during youth. If calcium intake is not sufficient, or if the body does not absorb enough calcium from the diet, bone production and bone tissues may suffer. The bones become less dense and more susceptible to breakage. In fact, in people with osteoporosis, bone fractures often occur with very little stress. Osteoporosis occurs gradually during aging and is more prevalent in women.
Animation shows a fracture in the bone.
And we'll be right back with much more on osteoporosis.
Still ahead.
So I fell on my wrist, and turns out it didn't just fracture, it wasn't a clean break, but it was shattered.
Red and blue text, ask Dr. Zach. Hospital recorder, the graph of a heart monitor, read on the walls. Text reads, ask Dr. Zach.
I fell
a woman
a
is
year
senior
ago,
walks to
August,
park. Text
my wrist.
osteoporosis.
I was at my
Shattered wrist.
campsite. So
Then
the
she
fire
sits on
pit
a
was there,
taupe
but
couch in her
it
living
wasn't
room.
lit.
Her name is
I
Eleanor
forgot
Joy,
it was
age
there, and I
73.
stepped against it, lost my balance, and I had no way of recovering because I was flipping back. So I fell on my
Eleanor
wrist.
opens and closes her fist and rubs
turns
the
out
joints
it didn't
of her
just
fingers.
fracture, it wasn't a clean break, but it was shattered. So maybe it was a good thing in a way, because due to all the visits and the x-rays and all that stuff, it turns out that I had osteoporosis, which I didn't know.
Then
The
she
physio
uses
has
a
shown
clothes
me
peg,
some
squeezing it
exercises to
open.
help strengthen my wrist and my fingers and straighten out the joints a bit more. And it's been a year, but you know, for a long time I couldn't get past this. So things are getting better every week. I was doing regular yoga. When I had the fractured wrist, I couldn't do that. I couldn't get down on the floor. So
Sitting
I'm
straight
doing
in
the
a chair,
yoga
she
where you
places her
either
hands
sit
in
the
prayer
chair,
position, then
stand
stretches
beside
her
the
arms
chair,
up
or
towards the
behind
ceiling,
chair.
then bends
Just to
down
help
from her torso.
keep the circulation
She stands in
going
a yoga
and
tree
strengthen up certain
position,
muscles and that sort of thing. And I do a fair amount of walking.
and then she takes
I'd
a
like to
stroll
hear
in
what
the
Dr.
park.
Zach has to say with regards to osteoporosis, and if there's something that he might be aware of that I'm missing at this point.
Now it's time to ask Dr.
Blue
Zach.
Tags Ask Dr.
Welcome, Eleanor.
Zach.
Thank you.
Back in the studio
Thank you
at
for
his
being
desk,
here.
Dr. Zach
Do you know if there's
Levine is
anyone in
joined
your
by Eleanor
family who's had
Joy.
osteoporosis before?
No.
Okay. And how's the wrist now?
Well, I'm still, working on things.
That's the maximum you can move
This
it?
is way better than it was even a month ago.
Oh, good.
So every month it's getting a little bit better. I can push it back,
Uh-huh.
and I can do so much, and I still get a little bit of physio once
Yeah.
every other week.
Okay, good.
And I do my own exercises.
And how about the classic things I'm sure you've heard for osteoporosis are calcium and vitamin D?
I do that.
Okay. Do you take them or do you manage to get them in your diet?
I think I'm getting some of it in my diet, and now I'm taking some supplements. I do everything natural.
Yeah.
And I am taking supplements, but I think I have another problem
Oh, what's
that
that?
I'm not absorbing or digesting, and I haven't figured it out.
Oh. Well, but that's significant, because oftentimes people who don't have enough of a nutrient, calcium or
Yeah.
vitamin D in this case, sometimes iron, it's because they're not able to absorb it properly.
Yeah,
So
I
it's
think
worth
that's
checking out.
an issue, and I've gone gluten-free.
Okay.
I've gone on to various products like Bone Basics for
Okay.
calcium,
Yes.
and I'm trying to pay attention to getting more of an alkaline acidic balance in my diet, pH balance.
Okay.
And I'm not doing very well with that, and I
Oh.
got really annoyed actually, and I've stopped testing because it's not going in the direction I thought it would be.
Yeah.
Because
Well,
I eat way better than most people, and yet I'm still too acidic.
I see. But have you actually had a follow-up to see your bone density, to see if it's...
No.
Because that's interesting. I mean, it would be useful for you to see, because it may be that you've halted the progression. So I think it would be nice for you to see, oh, look, my bones haven't gotten any thinner, so whatever you're doing might be the right thing. Diet is important, but exercise as well for the
Yeah.
bones.
Yeah.
So we always talk about calcium and vitamin D, making sure to have levels of those, like good levels of those in the blood, so that your bones can maintain their strength. Because we all start to lose a little bit of bone mass after about the age of 30. I think of a lot of things like muscles, like I think of the brain, I think of the bones. You kind of need to stress them to make them stronger or to maintain their strength, So with respect to the bones, that means exercise. And specifically, a couple of things. Number one is some weight-bearing exercises. So you said you're a walker,
Yeah.
which is great.
But it's not weight bearing.
Well, it is. No.
Oh, on
Weight-bearing
the
meaning,
feet.
yeah,
Yeah, but
exactly.
not
But
for
you're
the
right.
hands.
For the hands, so actually that's why some people do recommend some kind of work with weights for the upper body,
Yeah.
or swimming if that's something that interests you.
I'm doing chair yoga now because I couldn't go down on the floor. And I could be doing my exercises more. It just seems I have a very busy life and trying to squeeze it in.
Yeah.
But so I need to be more conscientious about that.
Yeah. Well, it's good. At least you recognize something that you can do to improve matters.
Yeah.
And these things do take a long time.
Well, somebody told me it could even be 2 years.
Yes. For like anything else, the effort you put in is
Yeah.
sort of related to what you get out of it. Are you taking any kind of medications at all?
Just natural supplements.
Natural stuff. No medications at all.
No.
What does your doctor think? Have they recommended you do that, or no? They don't think it's...
She's willing to listen to me, so I really appreciate that.
Absolutely.
She's not totally on my page.
Yeah. Doctors and patients have to work together, and if you're honest with your doctor, and hopefully your doctor is, first of all, listens, like you said, but also is open to different things. There comes a time when, the natural stuff isn't working, and people, like you may get to a point where it's so low that you may actually need a medication.
No, it's not going there.
Well, I hope not. I hope you're right. Absolutely.
Red and blue tags ask Dr.
Now,
Zach
Dr.
the
Zach's
prognosis.
prognosis.
The doctor stands before a monitor
Eleanor
showing
suffers
glass
from
and medical
osteoporosis,
animation
so
of a
thin
man
bones,
in
so she's at high
motion,
risk
his
for
legs and his
fractures, and
bones.
she's already had one. Now she's watching her diet and she is exercising, but she knows she needs to exercise more, and she needs to do things to strain, not too much, but strain the bones a little bit to keep them strong. In addition to that, she's watching her diet and she's watching the pH and the acidity. Frankly, I'm not sure if that does any good. The main things she has to watch for are to be physically active, very important, and also to get enough calcium and vitamin D. Other medications are available as well. She needs to follow up with her doctor and keep doing things and see whether her bone density is getting better or stabilizing or still continuing to get worse.
Red and blue tags ask
Don't
Dr.
get your blood
Zach.
pressure up. We'll be right back.
Red and blue tags ask Dr. Zach, doctor's orders. Dr. Zachary Levine speaks directly to camera.
Doctor's orders, consider the obvious. A lot of people go to their doctor complaining of fatigue, and they want a medical diagnosis. Now, your doctor will see you, they'll do some tests potentially, but most of the time it's from bad sleep or lack of exercise or just generally being unhappy. You need to address those things in your life before the problem will be fixed. There's no magic solution or pill for this.
Now it's time for you to ask Dr. Zach.
Red and blue
And now is the
text
time
asks
when we
Dr.
take some
Zach.
questions from the
doctor's
audience.
back in the
First
studio
question,
with the
please.
audience.
My name is Drina. I worked in the insurance industry, and a friend of mine read a book called The Grain Brain by David Perlmutter, and she went on a diet eliminating carbs and processed foods and lost 15 pounds within 6 months. Now, her triglycerides went down from 175 to 75. Dr. Zach, can you explain what triglycerides are and how carbs affect triglycerides?
There are a lot of different diets out there. The vast majority of diets fail within about 6 months, but they work for a month or 2 or 3. Triglycerides are one of the things that we consider the so-called bad cholesterol. The good cholesterol is the HDL, which is the high-density lipoproteins. The bad cholesterol is the LDL, which is low-density lipoproteins, and triglycerides. And so that's one of the things that we measure. And the question is, what is the relationship between carbohydrates and the triglycerides? And actually, until recently, we didn't really know, except that we knew that people who had diets that were high in glucose or fructose or any of those sugars tended to have increased triglycerides. One of the hypotheses is that having too much sugar, and especially refined sugar like white sugar or the sugar that's in things like candies and whatnot, that is toxic for the liver, and the liver is where the triglycerides come from. So the thought is that you get insulin resistance and you also get some toxicity to the liver from eating these very refined sugars, and that is what increases the triglycerides. So that's the best theory for now. I still think that a balance is a good idea. So some carbohydrates, some fats, some proteins, but choosing the right ones. So the best carbohydrates are the ones in fruits, for example. You know, that's the best kind of sugar you can get. Everyone cheats now and then. And then good kind of fats, so not the saturated fats, and then some protein. But you know, we all need some. Sometimes it's easier to have a clear guide as to what we really should eat, and I think that's where diets come in.
Thank you.
Thanks. So that is all the time that we have for today. I want to thank the guests for coming on and the audience for some great questions, and be sure to join us next time on Ask Dr. Zach.
MZ TV Production and Distribution 2016.